KTN News. Get the whole story.
Information and communication technologies have great potential in helping address some of the challenges faced by both developing and developed countries in providing accessible, cost-effective and quality healthcare services. My name is Dr. Masi Korir, and on this episode of Health Digest, we focus on telemedicine. Chebet Birir highlights how telemedicine is helping to overcome geographical barriers by increasing access to healthcare services.
If you're going to a hospital, even for, like a sore throat or something, you have to plan half your day off.
Access, equity, quality and cost-effectiveness are key issues facing healthcare in Kenya. Modern information and communication technologies such as computers, the internet and cell phones are changing how people address health problems not just in the country but globally.
I prefer personal face-to-face na daktari. That's the best way. Anaweza jua more about me, anaweza jua more about him.
Some trust issues.
Thank you for calling HealthX. My name is Dr. Martin Macau.
How may I help you?
Telemedicine, a term coined in the 1970s, literally means healing at a distance, and it is helping address some of these health issues.
People who cannot access healthcare easily, if somebody is remote, if somebody is in a remote place, if somebody is traveling, if somebody is far away from any place where they can access a doctor or nutrition services or psychologist services, we do have a big population of that. But you have a bigger population of people who have phones than you do of people who have access to healthcare. So basically that's where the gap was, or the gap is, when it comes to bridging healthcare. So it does not come to replace healthcare.
Dr. Macau is a medical doctor at HealthX, a virtual medical facility that utilizes digital platforms to provide telemedicine and telemonitoring services. The COVID-19 pandemic highlighted the importance and usefulness of telemedicine to provide a way to put patients and health professionals in contact when an in-person consultation is not possible. According to Dr. Macau, teleconsultations are a safe and effective way to assess suspected COVID-19 cases and to guide the patient's diagnosis and treatment, minimizing the risk of disease transmission.
What the pandemic did is that people had to innovate, because suddenly there are restrictions on travel. I'm sure you can remember you couldn't cross certain county lines, you couldn't travel at night, so people never used to go to hospital unless they were really, really unwell at night because of the risks, the chances of meeting government officials when you're going to hospital at night. And even in the workspaces, people were forced to find a way to make sure that work continues, even without being there physically. So these are the things that made people embrace technology easier, or telecommunication, if I may call it that. Because you find that, up to today, there are still people who are working virtually, people who are working through, media such as Zoom and the like. So now this actually made it easier for the population, for the people to actually embrace telemedicine.
So, what is the typical process of accessing healthcare online?
So this is basically the virtual clinic. You'll meet, one of our qualified healthcare providers through that virtual platform, whether it's a phone call or a chat or a video call. And after that, the doctor will assess your case, see if this is a case that you can finish during the phone call or during the chat or during the video call. Most of the times we will be able to conclude. Sometimes the outcomes are usually general advice. You're given advice concerning your condition. The outcome could be a prescription that you require, which will be done, and we have ways of doing it to make sure that it's a proper prescription. It cannot be counterfeited. It's one of the risks of virtual healthcare. The signature can be traced back all the way to the doctor. It has a digital signature that can be traced back to the doctor. Sometimes you might need a lab test. Sometimes you might need a referral. So all those can be provided virtually and sent to a patient either by WhatsApp or by email. Email is the most common we use, or even by text, because some people don't have access to email.
These medical devices are fitted with Bluetooth, hence they can be able to send results directly to the computer.
Once it records the temperature, it uploads to the machine, then sends it to the doctor, who could be even 500, 1,000 kilometers away.
And it is not just general consultation. Providers offering cancer care are leveraging on telemedicine. Patients in rural areas or those who are far from the hospital no longer have to travel all the way to see an oncologist.
Teleconsultation will be the future. We started offering many patients, they had issues in traveling with this lockdown of the borders lockdown. So we started offering the teleconsultations.
Dr. Ardash, who is an oncologist at Healthcare Global Cancer Care Kenya, says there are patients who cannot be seen virtually, especially if they seem to have signs and symptoms that cannot be attended to virtually.
If they want to come, I'll advise them to come as early as possible, because certain things that can't be addressed at the home, and they have to come to the center or the hospital.
Mental health services, especially for people psychologically affected by the pandemic, became a necessity. Virtual access bridged the access gap.
Many of the hospitals that would ordinarily offer some therapy also concentrated on COVID-19, so that avenue was closed. So we found ourselves dealing with bigger numbers, but the problem of access was a key issue. So the issue of telepsychiatry or telemedicine immediately became an important tool, and it's a resource that we had not exploited so much in the past, particularly in psychiatry and psychology, where we believe that physical contact is key for a therapist to be able to assess exactly the mood of the patient, the emotions that the patient is going through, to create that feeling of empathy and that rapport between you and your patient, as opposed to other disciplines of medicine.
There are instances where a patient needs emergency psychiatric services, and Dr. Njoroge says they are well prepared for such.
There are many things you could discover, especially when you're dealing with what we call psychiatric emergencies, and suicidal ideas or suicide is considered a psychiatric emergency. So anytime when we start to engage and realize that this is quickly we were able to assess the risk and find that this is a psychiatric emergency, then we have tools in place here at the Chiromo Hospital Group that we have like a protocol for how psychiatric emergencies are approached. Over and above, including things like getting in touch with the next of kin, getting information from you of where you are and your location. We have the services to actually come physically for you from where you are, and so on and so forth. And we have partners in different towns and different counties in this country, and we are able to use that wide network to be able to physically reach those people who we are not able to reach ourselves.
Lack of internet access may be a disadvantage for people who live in rural areas, as they may not be able to access such comprehensive healthcare services online. But according to Dr. Macau, there are solutions for that.
All you need is a mobile phone that is charged, and the cheapest mobile phone I've seen is 500 shillings. Those ones hold charge for like a week. Mobile phone that has some charge, and you can access network coverage. It doesn't have to be internet. You don't even need airtime because we have a toll-free number, so all you have to do is just be able to access a phone, and you can call. You can call in and basically be seen.
There are also instances where patients may be in need of emergency services. Such are referred to nearby physical hospitals.
We operate under a certain set of guidelines, and we know our limitations. We know the patients we can finish with because we have very nice guidelines, very good guidelines that are based on, there's a nice guidelines that are based on UK, then we have MOH guidelines which we use in Kenya, then because telemedicine is, it's basically an art and a science, we have our own telehealth guidelines which we've gained from 10 plus years experience from our partners and also our own experience. So we know our limits, how far we can go with the patients. So generally, if in talking to the patient we figure out this is a very urgent emergency, we actually let these patients know that we don't handle emergency care, and they should be, we will refer them to a hospital immediately. Both our doctors and our care coordinators, those are the guys who receive the phone calls, are trained on emergency services. So in case, it's something that you probably need to talk to somebody over the phone, like a child choking, or, something really urgent, we can do that. But we normally urge that, if they can go to hospital immediately, they go immediately. If it's an admission that they need, let's say, because not all admissions are emergencies, but once in the conversation we sense this patient needs an admission, we will refer them to one of the hospitals within their area. We've actually mapped out the hospitals, all over Kenya, so we kind of geo-mapped them, so we kind of know the locations.
According to the World Health Organization, developing countries are more likely to face challenges such as high costs, underdeveloped infrastructure, and lack of technical expertise when it comes to telemedicine.
In the cases we can't handle, we are dependent on the healthcare infrastructure that is already existent in the country. So if somebody calls me from, let's say a remote place in this country, without naming any specific county, a remote place in this country, and they need to see a cardiologist, and cardiologists are mostly based around Nairobi and Mombasa, or they need a certain lab test, maybe they need an MRI, and they're very far, they're places they can't access. So now that becomes a challenge that we face, in that we may not be able to sort that patient out completely because of the lacking infrastructure.
I'm not feeling well, and I wanted you to treat me.
All right, how are you feeling?
I'm having a headache and I feel a bit feverish.
Okay. Do you have the thermometer there with you?
Yes.
All right. Kindly take your temperature with it, and let me just confirm how your temperature is.
I've taken.
All right. Just one moment. So your latest temperature, which you've just taken right now, is 36.3 degrees.
Yeah.
Yeah, so which is normal, so you don't have to worry about that. Please just, if the pulse oximeter is there, just connect it so that I can have your readings.
Okay. So I'm worried. I have a friend who had COVID, and there's a day I spent with my friend. Should I be worried about it?
How long ago was that?
That was
How much time did you spend together?
That was like 3 days ago, and it was about like 2 hours.
All right.
Yes, I've taken my oxygen levels.
Okay. The current reading we have is 97%, which is normal, and your heart rate is also at 82 currently.
Okay.
82 beats per minute. Yeah. So allow us to continue on further review at a later time, if that's okay.
Yeah.
All right. Thank you very much, Kaluki. Shall call you back later.
Okay. Thank you very much, Doc.
Okay.
Experts say that telemedicine saves a lot of time and makes economic sense.
The time that the patient will spend in traffic, the time that the patient will spend on the queue, the number of sick off or off days people or employers have to give for somebody who's just attending a clinic, yet they can, call us during their lunch break. If they're not too unwell, they can call us during their lunch break. So generally you find that for the economy there is a lot of saving that we do, and also because it's easy to access. All you need is your phone. You don't need to walk up to a hospital. You don't need to go to a particular hospital. You find that people get treated earlier when you embrace telemedicine.
Apart from consultation, diagnosis and prescription, access to medicine is the next key step.
I think things have changed. I mean, they often say it takes, I can't remember what it is, it's about, I don't know, maybe 28 days or something like that to change a habit. Yeah. We've had 2 years almost. Habits have changed, and people have got used to moving more and more online. Whether that be for their groceries. I mean, I get my groceries delivered to my house now, instead of going out and having to deal with the traffic chaos at the moment. So I get those things delivered. So people who may have tried us during COVID, I think are certainly continuing to use us, and more new people are continuing to use it as e-commerce, I suppose, comes of age in Kenya. Even e-commerce, Amazon has been around a long time. It's really taken off. And I think that's it here. And I think for healthcare as well, I think it's slower for healthcare because you've got to trust who you're dealing with. Everybody trusts their local pharmacy. Everybody trusts their local doctor. Yeah. So people, you've got to build that trust with clients, with patients. And I think over a period of time we have done that with those who use my dial.
Online pharmacies, however, do not sell prescription drugs without a proper prescription note.
Don't necessarily consult Dr. Google and try and get whatever medication Google has said you need. That's obviously not the way. Prescription medication should only ever be dispensed under a prescription. So if you're working with anybody online who is going to dispense prescription medication, and that includes antibiotics, without a valid prescription, think twice, because that's not following the Pharmacy and Poisons Board's guidelines. And if they're not prepared to follow those guidelines, what other guidelines are they not prepared to follow?
Even though telemedicine may be the most used means of accessing healthcare services in future, experts say face-to-face consultation will still be important.
Telemedicine cannot erase the importance of face-to-face consultation. It can only augment or complement or add on to it.
We don't have a lot of players that are handling the whole process, and I think as we go into the future, that is where we are headed towards to, where the full process is going to be automated, and you will have a choice as an individual to either go the telepsychiatry way or to look for your therapist physically, or even a hybrid. And I suggest in the coming days, generally a hybrid is going to be very beneficial to each and every one of us. That technology, as it advances, we also have to advance with it. Telepsychiatry is here to stay, in my opinion, and is something that we have to embrace. And telepsychiatry is a very interesting phenomenon, and it takes the whole process from booking sessions for yourselves online you ideally are able to go online and find a therapist of your choice and look at their schedule and book an appointment for yourself. And once the appointment is booked, you are able to be given a link or the forum through which you're going to interact. And then after that, suggestions are made. And if there is a prescription, it is done, and it is actually even delivered to you.
Not everybody has access to a doctor, so for us at least now, we're increasing the accessibility of that. But face-to-face, you can't replace it, because even here in practice, in telemedicine, here in HealthX, there is a certain proportion of patients that you will refer to face-to-face communications, face-to-face consultation, because the doctor does need to examine in a number of cases, or even something like if a surgical procedure is required, a specific medical examination is required. This will require face-to-face. So we're just augmenting the service and complementing the service, not really replacing it.
As part of the goal to achieve universal health coverage in the country, the Kenya Medical Practitioners and Dentists Council, KMPDC, commenced the issuance of provisional approvals for various registered and licensed health institutions to offer virtual medical services in February 2021. So far, about 20 health facilities have received approval from KMPDC to offer telemedicine services in the country.
Initially in Kenya, it probably started with apps, applications, which mainly just served as doctor directories. It was like an online directory that you have on your phone that has the doctor's phone number, address, etc., etc., like my yellow pages for doctors. But now it is developing. Now you have facilities like this that other than just having doctors' phone numbers, now you have a facility like this that actually has guidelines on telemedicine and telehealth in particular, because it's not really the same as seeing a patient face to face. In future, as technology advances, it'll probably be more advanced. As infrastructure develops in Kenya, like right now, we offer consultancy services. We're fortunate in Kenya, there are a few people who are offering mobile laboratory services. There are people who are offering mobile medication delivery services. They'll deliver right to your home. So this is the network we're working in. So in future, we'll probably have more and more providers. So we'll be able to do more and more services right at people's homes or offices where they are. And maybe, who knows, like in countries like Dubai, you have even like critical care patients under critical care at home, who are monitored, on a telemedicine kind of platform. And in future, you never know. Maybe even things like procedures will be able to be done on a telehealth platform.
Telemedicine has proven to be not only convenient for patients, but it also has other benefits such as improving public health, relieving pressure on the healthcare workforce, and helping to reduce financial stress. Chabet Birir for Health Digest, KTN News.